Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. We're going to study General Anatomy of Bones, Part 2. I've already taken a lecture 1 on General Anatomy, in which I've covered all this, long bone, short bone, flat bone, and so on. I've also covered an important short note on sesamoid bone. So I request all of you to go and check out that. The link for that is given in the description section. Don't miss the lecture 1. Let's now go to lecture 2, where I will be teaching you ossification, parts of long bone, what is diaphysis, what is epiphysis, and so on. And then in the end, I'll be taking a blood supply of long bone, which is another very important short note for all of you. Let's begin then. What is bone? We know it's a specialized connective tissue, which is rigid because it's so mineralized, highly vascular, and constantly changing. My question to all of you is, how is a long bone really formed? Have you thought about it? Yes, it is formed in a little baby with the formation of a small cartilaginous model. Okay, instead of the bone, there's a model of cartilage formed. Then one day, a blood vessel enters into that model. Okay, slowly the blood vessel begins to lay down bone. This is the first bone formed and therefore is called as primary center of ossification. This center will finally form the diaphysis of bone. With time, the two ends of the cartilaginous model also begin to get blood supply and new bone gets laid down there. This new bone that gets laid down is called as secondary center of ossification. This will develop to form epiphysis. Got it? So, primary center of ossification, diaphysis. Secondary center of ossification, epiphysis. And slowly, bone will form. Separating the primary and secondary centers of ossification, there will still be a cartilage, which is called as epiphyseal cartilage. Okay? It will obviously be at both the ends. So, let's begin to understand something about ossification of young long bone. What is center of ossification? Where ossification first begins, or where bone formation first begins. What are its types? We already saw. There is a primary center and there is a secondary center. Where is the primary center? In the middle of the long bone. Okay? Now this is important. It appears before birth. All primary centers of ossification appear before birth. Is there an exception, ma'am? Yes. The primary centers for carpals and tarsals appear after birth, except in case of calcaneus, talus, and cuboid, which still appear before birth. This is a little confusing, but you have to remember it because it gets asked in MCQs. Okay? Right. So what about the secondary center? The secondary center appears here, as you can see. It appears after birth. Okay. What is the exception? मैम पहले exception था तो surely अभी भी होगा. Yes, अभी भी है. So what is the exception here? The secondary center for the lower end of femur and upper end of tibia appears before birth. Please say it once. Secondary center for the lower end of femur and the upper end of tibia appear before birth. How does it matter? Yes, it matters. I'll tell you, it's a very interesting story. See if you're ready to listen to it. You're practicing in a remote village. You have barely got an X-ray machine. No other fancy investigations available. A man comes to you with a dead female child and he says, this child was born dead, Sahib. You will say, why? He says the baby was premature, barely 7 months, and that's how the baby was born dead. What do? You take the baby and you take an X-ray of it. But you find that there is a primary center of ossification for the lower end of femur, which appears in the 9th month of intrauterine life, which is 100% proof that the child was at least 9 months. Now, this is not proof that this child was killed. No. This is proof that either he doesn't know his mathematics or there is a reason that he is lying. This is enough for you to suspect that this may be a case of female feticide. Okay, so that is why knowledge of anatomy is extremely crucial. Fine. With this, we go to, so it's a common Viva question. What is the significance of knowing that primary center of ossification for lower end of femur appears before birth? This is the significance. Please hear this thing once more so you will understand it better. Right. Students, if you're enjoying the class, please like and subscribe. It will encourage me to make such videos for you. Right. So let's go now to parts of a young long bone. We've got some information. Let's see if you're able to understand it. This is the primary center of ossification which develops to form the diaphysis. This is the secondary center of ossification which develops to form the epiphysis. This is the epiphyseal cartilage. You can see it here as well. And this here is the metaphysis, which is the part of diaphysis which immediately abuts the epiphyseal cartilage. Okay. So these are the parts of young long bone. Let's discuss each of them one at a time. Would you like to revise once? Yes. Diaphysis, epiphysis, epiphyseal cartilage, metaphysis, covered by articular cartilage. Right? So let's begin to discuss each of these parts one at a time. First, diaphysis. It's the shaft of the long bone is called as diaphysis, develops from primary center of ossification. Perfect. What about epiphysis? It's the end of the long bone which develops from secondary centers of ossification is called as epiphysis. Now we come to something important. Epiphysis is not, there are many types of epiphysis. Okay. So the secondary centers develop into a number of types of epiphysis. Let's enumerate them once. Pressure, traction, atavistic, and aberrant. So very important. It's very commonly asked MCQ. So let's talk about them a little bit. What is pressure epiphysis? An epiphysis which is formed at a place where body transmits weight. You will call it pressure epiphysis. Can you give me example? Head of femur? Yes. Head of humerus? Yes. Lower end of humerus? Yes. Upper end of radius? Yes. Wherever there is transmission of weight, okay, you will call it pressure epiphysis. Right. These are the examples. Let's talk about traction. Epiphysis that is formed at a place where there is pull of a muscle. Okay, you call that as traction epiphysis. So you can look at this one here, lesser trochanter, pull of a muscle, greater trochanter, again pull of a muscle. So trochanters of femur, tubercles of your humerus are all what kind of epiphysis? Traction epiphysis. Good. So I want to put a little law, subjuga law in life also, in human body also. Okay, so let's talk about one little law. In a bone that contains pressure and traction epiphysis, for example, the femur, the pressure epiphysis appears first, always appears first, and fuses with the diaphysis last. Epiphysis has to fuse with diaphysis. This pressure epiphysis fuses with the diaphysis last. Okay, right. Continuing to discuss epiphysis, we come to atavistic epiphysis. Now, this is very interesting, students. This is a bone which is phylogenetically independent. As per evolution, this bone is a separate bone by itself, but it slowly goes and gets itself attached to another bone so that it can acquire nutrition from it. Okay, so attached secondarily to another bone for getting nutrition. Listen carefully. Two examples. One is coracoid process of scapula. By now you should know how to palpate your coracoid process. Okay. Or the posterior tubercle of talus, also called os trigonum. What is it called? Os trigonum. Give me both the examples now. Coracoid process of scapula, posterior tubercle of talus, also called os trigonum. These are examples of which epiphysis? Atavistic epiphysis. Very good. Again an MCQ. What is aberrant epiphysis then? When an epiphysis appears where it shouldn't be, you call it aberrant. For example, now this is an metacarpal. Normally you will have epiphysis for the lower end. You will not have epiphysis for the upper end. But in this case, an epiphysis has appeared for the upper end. That is why we call it aberrant epiphysis. So, see if you can solve this MCQ. Following pairs of epiphysis and its examples are correct. Head of femur pressure epiphysis? Perfect. Greater trochanter traction epiphysis? Absolutely. Lower end of femur traction epiphysis? No. It is transmitting weight. It has to be which epiphysis? Pressure epiphysis. And so on. Let's take it further now. What is epiphyseal cartilage? What is growing end of bone? I've told you that when there is diaphysis and there is epiphysis, the cartilage in between is called epiphyseal cartilage. You can see that in the image here, isn't it? So, epiphyseal cartilage is the cartilage between epiphysis and diaphysis. Now, what happens? Finally, the diaphysis fuses with the epiphysis. As it fuses, the epiphyseal cartilage disappears. Look at it again. The diaphysis fuses with the epiphysis. Epiphyseal cartilage disappears and there is formation of one bone. Correct? So finally that is what is going to happen, and that's how you will have a complete bone. So epiphysis that unites last with the diaphysis grows for a longer period of time and is therefore called growing end of bone. This is very important, students. Listen carefully. You have got an diaphysis, an epiphysis and an epiphysis. In between them you have got cartilages. One day the diaphysis fuses with the epiphysis. Diaphysis fuses with the epiphysis and a single bone is formed. Suppose it fuses here first, maybe at 17 years, and fuses here last, maybe at 19 years, to form the bone. Then which end grew for a longer period of time? The upper end. And therefore it was called as the growing end. The end that grows for the longest period of time is called as the growing end of bone. Okay, so that is the concept of growing end of bone. Right. The end where the secondary, so we now come to a law. Okay, the end where the secondary center of ossification appears first fuses last with diaphysis. The end where the secondary center appears first fuses last with the diaphysis. Okay, that end is called as the growing end. Put that in your brain. I'm going to keep this sentence and let's solve this question. Epiphysis for 1 second. Epiphysis for the head of femur appears at an age of 6 months. Greater trochanter 4 years. Lesser trochanter 12 years. And lower end, I already told you, 9th month of intrauterine life. So, the end where secondary center appeared first, here, fuses last. So, the fusion between this epiphysis and the diaphysis will take place last. Therefore, in this femur, which will be the growing end of the bone? Obviously, the lower end. This is how this knowledge helps you to decide which is the growing end of bone. The growing end of bone is found in a direction opposite to the nutrient foramen. So, if you don't remember all this, how will you know which is the growing end? Pick up the bone, look for the nutrient foramen. In this case, the nutrient foramen appears to be directed downwards, which means my growing end has to be upwards. The growing end of bone is found in the direction opposite to the direction of nutrient foramen. Nutrient foramen directed downwards, growing end is upwards. Okay. There's a little saying for this. To the elbow I go, from the knee I flee. Look at the arrows to understand. Nutrient foramina go towards the elbow and away from the knee. Therefore, state the growing end of humerus. Nutrient foramen is directed to the elbow. Which is the growing end of humerus? Obviously, the upper end. In case of tibia, which is the growing end? The nutrient foramen is directed downwards. Therefore, upper end of tibia is the growing end. So, these simple dictums help you to understand and conceptualize the topic better. Why are we trying to get this knowledge, madam? Isn't it? That must be the thought coming to your mind. The importance is that if the growing end gets damaged, okay, there is a problem and there's a delayed, there may be abnormal ossification, okay, there may be shortening of the limb, and that is why we have to know the growing end. Let's now come to the last discussion, metaphysis. As you know, the part of diaphysis immediately adjacent to epiphysis is called as metaphysis. Okay, so it is the most actively growing part of bone. It has very high blood supply. Can you come here to this image now? Can you see how it is having blood vessels coming here from the core of the bone, from the metaphyseal arteries, from the epiphyseal arteries, and there are blood vessels forming hairpin bends. Now what happens is, in these hairpin bends, sometimes blood clot, sometimes infected bacteria get stuck, and this results in infection of the metaphyseal end of bone. Okay, once the metaphyseal end of bone is damaged, it is likely to affect the growth of the bone, because metaphysis is the growing end of the bone, isn't it? So that is why knowledge about metaphysis becomes, and its possibility of its getting infected is important for you. Also, it has a lot of muscles attached to it, because of which the pull of these muscles also sometimes damage the metaphysis. Right. So what have we learnt? We've learnt about primary and secondary centers. We've learnt about parts of long bone. We've learnt about types of epiphysis with examples. We've learnt about what is concept of growing end of bone, how to understand which is the growing end of bone, and so on. Okay. With this, we come to the last topic for today, which is the blood supply of long bone. Comes as a very common short note for you. Remember, there are 4 arteries which supply any long bone: nutrient artery, periosteal artery, metaphyseal artery, epiphyseal artery. Let's learn about them one by one. So here let's talk about nutrient artery. The nutrient artery, as it enters into the bone, becomes very tortuous. Why is it tortuous? Because as the bone moves, you don't want the arterial supply to be compromised. So it's very tortuous. Now what does it do? It enters into the bone through the nutrient foramen. After entering in, it divides into 2 branches, which are called nutritiae. These branches reach the end of bone, forming hairpin-like loops. Can you see the loops there? Which area is that? Metaphysis. Yes. It also gives rise to branches that supply the inner 2/3 of the compact bone and the bone marrow. Okay. So that is the nutrient artery. Okay. We'll revise it in the end. So the next set of arteries are periosteal arteries. Periosteal arteries are arteries coming from the surface of bone, from beneath the periosteum, supplying the outer 1/3 of the bone. Numerous periosteal arteries will be found on those bones where there are a lot of muscular and ligamentous attachments. There will be fewer if muscle attachments are lesser. Okay, so here you are seeing periosteal arteries entering in. Okay, what is the importance of the knowledge? See, what happens is sometimes when there is a fracture and there is overlying muscle tissue is less, then often that bone goes into non-healing because of poor blood supply to the fracture site. Okay, right. We now come to the last 2 arteries, metaphyseal artery. So we've done nutrient, we've done periosteal. Now here is the metaphyseal artery supplying the metaphysis, and epiphyseal artery supplying the secondary center of ossification. All these arteries, remember, are going to anastomose. In that square area I have shown the metaphysis. Okay, metaphysis is therefore the most vascular area of the bone. Ready for revision now? The nutrient artery enters into the bone. It's very tortuous, enters in through the nutrient foramen. Divides into 2 branches, one going up, one going down, called nutritiae. These form hairpin-like loops in the metaphysis. These finally supply bone marrow and inner 2/3 of the bone. Similarly, from the surface entering in are periosteal arteries supplying outer 1/3 of bone, metaphyseal arteries and the epiphyseal arteries. All these supply the long bone. Metaphyseal arteries and all the others form an anastomosis at the metaphysis. So how will you write a short note on blood supply of bone? You will draw the diagram first, see the diagram, and you will write a note enumerating the 4 arteries, describing each artery, and finally writing applied. What applied can you write? You will write how infection get caught in the hairpin-like loops, forming infection in metaphysis. This can lead to what is called osteomyelitis. Then, in case of fracture bones, if the overlying muscle tissue is less, then periosteal blood vessels are less, very likely to go into non-healing. Tearing of the nutrient artery also can result in poor healing of fractures. So with this, students, we complete the topic of bones part 2 with a note on blood supply of long bone. Remember, the diagram of blood supply of long bone is being released as a separate video. Please go check it out and practice drawing of blood supply of long bone. It's a very commonly asked question. You should know how to draw and describe it well. Right. Again, students, if you've enjoyed this lecture, do please give me a like and subscribe to the channel. And do share your thoughts in the comment section. I will know what is working and what is not working so that I can modify my lectures accordingly. Right. Students, we've covered general anatomy part 1 was covered, and the link for this lecture is given in the description section. Please go check it out. With this, we complete the lecture on bones part 2. Hope is a pocket of possibility. Sometimes you will find yourself losing hope. You feel, ye to mere se ho hi nahi sakta, I can't study so much. Hope is what drives most of us. It will drive you also. Come on. Thank you, students. I had a pleasure. I had great pleasure taking this class. I hope you enjoyed it too. See you across the screen in some other video. Thank you.